Good evening and welcome to the joint meeting of the school committee and the Board of Health for the town of Winthrop. The date is Tuesday, November 17th, 2020. This meeting is being held by way of a Zoom teleconference and may be televised. Okay, under general functions, Board of Health review of the current COVID-19 public health status, review and discussion related to the school health and safety measures in response to COVID-19 protocol that can be implemented. Ms. Howard, could you bring us through that, please?
Sure. I see that Astrid Wines is on, and Astrid, I don't know if the other members, I see Susan is on. Is Bill on? Oh, I'm talking.
I spoke to him. He said he was coming on.
He'll be calling in.
Okay. So we have, the school committee has asked to hear from the Board of Health to get some information from them related to the current health of our community. And also, now that you've had the opportunity to review the plans that the school has in place already regarding our health and safety of our students and staff, we just were seeking some feedback from the Board of Health as to sort of the situation in our community, how that relates to what you have had the opportunity to read about our plans moving forward, including, most importantly, the school committee's vote to launch our hybrid learning plan, as well as our fully remote plan for our families, effective December 7th as of now. So we were seeking feedback from you just regarding those those two items. So I'm going to turn it over to the Board of Health to begin to let us know some thoughts that they have.
Thank you.
Is Bill here yet, or should I start?
Yeah,
Oh,
hi.
he's here. Okay, good.
Yeah,
Oh, we had a problem with my phone, so I apologize. So I missed the last couple of meetings. So is it our turn to
Yeah.
speak?
Yes.
So hi, this is Bill Schmidt, the chair of the Board of Health, and I appreciate that the school committee has invited us to participate in this discussion. As you probably know, the Board of Health is in a position to offer guidance to the school committee and the superintendent on their reopening plans. The ultimate decision on the reopening of the school and the timing is clearly the jurisdiction of the superintendent and the school committee. Astrid has prepared some slides that she wished to offer for consideration, so I'll turn it over to her at this point.
Thank
Okay.
Astrid.
You need to enable the screen sharing for me.
Yep, I'm gonna make you co-host.
you.
Okay,
This
You
during the presentation.
should be able to now, Astrid.
Yep. Okay. Okay. So just to reiterate what our role here is not to make a decision on whether we should open the schools in Winthrop or not. It's really just to merely provide some input from our perspective. After all, it's a decision that has to be made based on a lot of different factors, and we're really just providing some enlightenment on one of them, which is the public health of our community. So first of all, I just want to go over a few things here regarding the COVID risk for school-aged children. So what is known in the scientific community is that children are less likely to transmit and to contract the virus than adults. And that is true for preschoolers most of all. They're less likely to transmit and contract than elementary schools, and those are less likely to transmit and contract than high school kids. High school kids are really very similar to college age adults. So they have a higher likelihood to both transmit and contract than younger children. All children can be infected and spread the virus to others, that is known. Infection occurs more often in teenagers than among younger children, and older children appear to be more susceptible to infection and to transmit more often than younger children. So that's just one important point to keep in mind here. There is a very strong link between the number of outbreaks in schools and local community transmission, meaning if you have low rates of transmission in the community, you have a very low risk at schools, and that doesn't really change your risk much if the school is open or closed. And if you have high community transmission, then obviously the school is not a microcosm and reflects what is happening in the community is also reflected in the school. Schools being open in the past and in the last few months has not led to a rise in community spread overall when community infection was low. And that's a very important point, very important determinant. Community infection low, schools don't pose any additional risk or enhanced risk to the community. When community infection is high, it's reflected in the school transmission as well. Preventative measures, prompt case detection and contact tracing averted larger outbreaks for the most part. So those are very important measures that we and others need to take who wish to open schools. And then there were some large outbreaks that have received a lot of attention in the media. One was in Israel with 178 cases, 153 students, 12 to 18 years of age, and 25 staff members in a high school. That school was extremely crowded. They had few measures in place. They didn't have a mask mandate in school. So it's very important to just keep in mind that the big outbreaks that have been in the media, including also the one in the overnight camp in Georgia that affected 260 cases, they had very few preventative measures, mitigation measures in place. So that's not really a comparison to what's happening in Massachusetts in any school here. When there is widespread community transmission of SARS-CoV-2 or the number of cases is rising, it's obviously much more important to have protective measures in schools than when you don't have high community transmission. So let me go to the next slide. So again, there were very few outbreaks reported in schools since early 2020, and most infections or COVID-19 cases reported in children, infection was acquired at home, not at the school. More outbreaks were reported in secondary and high schools than in primary and elementary schools. This reflects the notion that children of less than 10 years of age are less susceptible and less infectious than older children. And in school outbreaks, it was more likely that the virus was introduced by an adult, mostly the personnel, than by a child. So that's another very important factor to consider. Overall transmission from staff to staff was much higher than between staff and students, either way, and that also was much higher than student to student. So another thing that's important to know. And then the modeling studies that we have from the first few months of COVID suggest that closing schools reduced community transmission less than any other social distancing intervention. So the schools have, the closing of schools had very little effect on the overall rate of community transmission, much less of an effect than any other measures that were taken. I just wanted to go over this study real quick because this has received a lot of attention. It was also in the media, and this is just recently published. It's in the Journal of Pediatrics, which is a very highly regarded journal, high impact journal in the medical world. And it's about COVID-19 transmission in US childcare programs. So they looked mostly at how much the staff in childcare programs were affected by COVID-19. So they didn't really look at the kids, they looked at the caregivers, okay? And so I have all of you here in the way, so I'm gonna have to move you away. Overall, we found no evidence, and this is a direct quote from this paper, we found no evidence of childcare being a significant contributor to COVID-19 transmission to adults. This finding is consistent with previous studies showing a lack of association between school closures and transmission rate. And this, again, is transmission from adult to adult and from child to adult, not the other way around. The caveats of the study is the study focused only on children to adults and adults to adult transmission, and it only really looked at settings providing care to children, and most of those children were less than 6 years of age. So just really more of a preschool focused study and not so much, any kind of high school or even elementary school age children. Adults overall are more likely to transmit to children anyway than children to adults. So that's why there's a skewing towards this kind of transmission route. Children represent overall much lower percentage of COVID infections. And then what they say too in the paper, and this is also a quote, that spread from childcare workers to children may still lead to children's family members, including those most vulnerable to the virus, contracting COVID-19 from their children or grandchildren. So kids that might bring this home from school because they got it from a caregiver might give it to their vulnerable adults in the household. What they say very clearly at the end of this discussion in that paper is that if they adjusted, after they adjusted for all these variables, all other variables, community level transmission remained a significant predictor of childcare providers testing positive or being hospitalized for COVID-19, highlighting the importance of reopening childcare programs only when background transmission rates are low and decreasing. So they use the World Health Organization threshold of less than 5% positivity for at least 14 days as a good measure for when you should open schools or childcare programs and when you should not. And then it also said that although the study provides evidence that childcare may pose negligible threat to community transmission, communities may pose a considerable threat to childcare. So it really is important to see it that way, that the childcare facilities don't pose a threat to the community. It's the other way around. The community poses a threat to the childcare facilities when you have these high background transmission rates. So conversely, when you have low rates and they're well managed, these, these infection mitigation efforts are in place, these transmissions are really, really rare. So let's look at the US overall. There is this page called US COVID-19 School Dashboard, which is a crowdsourced site that is available. If you Google that, you can look at it and you can, search for all kinds of different parameters. Those are schools that are reporting to the system. It's not a mandated reporting, but I think about 9,000 schools or so report to this from all over the US. And what's important here when you plug in, just overall everything hybrid and full in-person schools, that overall staff seems to be at higher risk than students, which is kind of probably a function of the fact that adults are just generally more affected than children. And students and staff rates totally mirror more or less community case rates. So it really is very noticeable that when the community rates are lower, rates in schools are lower, and vice versa. So it really has a direct impact what your community rates are on the school rates. And then there's this paper that was in the Boston Globe, this report that was in the Boston Globe just a couple of days ago, where they have this map of reported COVID cases at schools. You can see here that, and this is a community up north. This is Haverhill, actually, and this is Fall River down here, and that's Boston. The little black dot here is actually Winthrop. We obviously have very low cases because we don't really have anyone at school right now. But in communities like Haverhill here, which has a little bit lower transmission rates than Winthrop, in fact, right now, they have significant spread at their school. They had a kind of an outbreak happening there. So it does happen, but it's very rare. And overall, you can see the rates of transmission in Massachusetts at schools are very, very low. And what we don't know is if these kids got the virus at school or if it just overall happened due to some outbreaks in the community. What metrics are we using for community risk designation right now? And this is the new metrics that just came out about a week and a half ago by the governor. Winthrop falls into the population here from 10 to 50,000 residents. And here the metric is used for yellow. You have to have, you can have greater than 10 average cases per 100,000 inhabitants, or a greater than 5% positive rate. That's kind of where we're at right now. And we have 62.1 per 100,000 is our current rate as of last week. On Thursday, we get the next report, then we'll know. And we have a 4.85% positivity rate in Winthrop. So we fall right into this like high yellow cohort. What's noticeable here is that we are about double the incidence rate of other yellow communities in that cohort. So we're the highest actually in that yellow cohort in terms of the cases, and we're about the third or fourth in terms of the positivity rate in that yellow cohort. So we're kind of like getting up there, but we'll have to see if we go to red this week, or if we stay in that yellow cohort here. Then just to look at our daily incidents over the last few months. So if you look here from the beginning of the pandemic, we had that first peak that was in April and beginning of May. And then we were kind of on the low side for a long time. And then just recently, last month, about a month ago, we started having these outbreaks. And here's our peak right now. So we are basically now at 62.1. And if you look at when you last voted, and correct me if that's wrong, I think that was on sometime in like mid-August when you last voted for, I think, remote back then, that was here, and now we're here. So obviously we have a much higher daily incidence rate right now than we had back then. Just for your information, this has I'm not making any judgment here. I'm just really telling you the facts where we're at right now. In terms of the positive test rate, that's been fluctuating a little bit. This is around the time of your last vote here. We were around 3.5%, and now we dipped down a little bit, and now we're back up at 4.85%. And the trend is going up right now. And we are considerably higher than Suffolk County as a whole at 1.71%. And then when you look at Massachusetts metrics, the positive test rate has been going up, unfortunately, pretty significantly. This is, again, where we were back in June, pretty high, and then it went down, and now it's going back up. And if you actually correct for the Massachusetts higher education testing, for which they're doing a lot at colleges right now, if you take that out of the equation, our positive test rate is actually quite high at 5.25% in the Commonwealth. So we're seeing an uptick in cases in terms of the positive test rate, but that alone, you could say, well, people argue about, well, who's getting tested, how many times are people getting tested, all these things. But I'm showing you this graph, which is, I think, much more compelling to me, because this shows you what's in our wastewater. This is actually MWRA data on how much virus RNA signal there is in our wastewater. So we basically excrete virus, when we go to the bathroom. And this is essentially what we had. This was the peak back in April, where we had a lot of virus in our wastewater, and then we had almost nothing. And now we're getting up there again. And this really directly reflects how much virus load there is in our communities in Massachusetts. And this is just northern Massachusetts, which includes Boston and also Winthrop. So I'm just telling you this to show you that there is actually pretty objective data that is not reflective of just the testing and who's getting tested, but really shows you that we are seeing an uptick in viral load in our communities. And my projection and the projection of a lot of public health experts, and I'm not a public health expert, but I am on the board of health and I'm a physician, is that I think we will see an increase of this activity due to we will be in colder weather very soon. People are spending more time inside. There are going to be major holiday gatherings happening. We have Thanksgiving coming up. We have Christmas coming up. And then also we have college students that are going to be returning from out of state soon. So I believe all these things are going to add to our caseload. That doesn't mean that as a community we're going to do worse, but I think as a whole in Massachusetts, we're going to do much worse in the next month or two. Again, the modes of transmission of SARS-CoV-2, something that is very important to keep in mind. There are 3 major modes of transmission. There's also other things that you should keep in mind, that they could, bind to surfaces and things like that. But that's really negligible when you compare them to these. There's the contact mode, which is direct contact with infected people and their secretions. And then you have the droplet mode of transmission, which is through saliva and respiratory secretions, through sneezing, coughing, singing, all of that. And then there's also this, which is the airborne transmission or the aerosol transmission, which happens through exhaled air. And then you would end up with aerosolized, really, really tiny particles in areas with poor ventilation that can travel quite far. And how do you mitigate for these things? For contact and droplet transmission, you obviously mitigate that with physical distancing. You get away from people. You don't inhale these, clouds of virus particles that are coming directly from these individuals, and you practice proper hand hygiene. And droplet and airborne transmissions you mitigate with wearing a mask and using ventilation. And all these things are really important in mitigating COVID-19 transmission in schools. So again, school outbreaks, but really any outbreak in an indoor space are associated with increased community transmission, insufficient physical distancing, poor ventilation, and lack of masking. And that's been shown and that's been demonstrated in many, many studies that these are the main things that are contributing to these outbreaks. So what mitigation strategies do we have in place for schools? And I just want to briefly go over these, and then Lisa can talk about it in more detail, but these are the main things that we should keep in mind. The first important mitigation strategy is to minimize the import of COVID-19 infections into schools. And that's really a community-based effort. That is us, all of us. That is not the school, that is not the state, that is us as a community. We have to, anytime we're symptomatic, seek diagnostic testing, okay? We also need to recognize that 15 to 50% of children and 10 to 30% of adults may be asymptomatic or infectious while they're pre-symptomatic, meaning before they become symptomatic, they're already infectious. So this is really something, and that's kind of the wild card in this whole thing, right? We don't have school-wide testing-based surveillance available right now. It's just not feasible yet. We don't have the infrastructure for it. We don't have enough testing yet, and we don't have enough availability of personnel to do this. So it's not fast enough. So this is not available, and this is really where the biggest wild card is in this whole opening of schools, that we don't know these asymptomatic individuals. And then what becomes really important is the daily symptom screening and attestation by all parents and also the staff, that they have to fill out a survey every day saying our child doesn't have, any symptoms, yada, 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 has not been in contact with anyone who had COVID, and also doesn't have, has not tested positive for it. And then the most effective tool obviously would be to restrict in-person learning to when community infection is controlled. So there are a lot of different standards. Some people say you have to have less than 10, less than 30, whatever. There are different standards in different countries and even different states of new infections per 100,000 per day, or less than 5% positivity rate over a prolonged period. These are the most common criteria that people are using to determine when in-person learning is safe and when it's maybe less safe. And then the second mitigation strategy would be to minimize the likelihood of transmission at school. So that's the school effort. That's where the safety plans, the exposure control plans, all of these things come into play. That's where we have to make sure the kids are, and also the staff, are physically distancing, that they have they limit room occupancy, so we don't fill the school with students. We actually reduce how many students are attending at any given time. We really want to practice crowd control at all sites, including drop off, pick up, in hallways and bathrooms, things like that. We want to limit duration of potential exposure. So that means the mask breaks, which they are usually built in schools, should be limited to, 5-10 minutes, something like that. The lunch breaks should be really limited to the whatever time that is necessary to eat your lunch, and then the mask should go back on. Surfaces have to be disinfected, although that's probably the least important of all the measures, because people should not be really sharing spaces to a degree where they use the same surface. Ventilation, very important. We have, and I had that question for Superintendent Howard several months ago. How is our status momentarily with the ventilation systems in the schools? We have significant upgrades that were made this summer in all the schools to the ventilation system and the filter size. MERV 13 is the lowest filter size that is really filtering out significant aerosolized viral particles, and that is available in all the schools, and most of the schools actually have higher filter systems even available, the highest ones that are available for the systems that are built into the schools. So that's very good in Winthrop. Hand hygiene is important. Masking, obviously, I don't have to say that again. Masking is key. And then also limiting your indoor activities and doing as much outdoors as you possibly can. Obviously, that will be hard in the winter time, but it might still be possible to some degrees to move some of the schooling outdoors. And then the third mitigation strategy would be avoid outbreaks at school. How do you limit secondary transmission to the smallest number of persons possible? So if you have an outbreak, how do you limit it to make sure that not too many people are affected? And that's really done by the school and they will make sure we have small cohorts in classes, 10, 12 students, not more. That these students are also early, that are detected in an early fashion if they are symptomatic also at school and are immediately isolated if something comes up. That we perform early and fast diagnostic testing when these students do show up with symptoms. And that's really our health department. Here's a picture of Meredith, and also the contact tracers that are calling from the state. That is a very important thing, that people are responding to those calls and giving information. So these are really the factors that avoid and limit outbreaks should that happen. So that's another very important factor. So overall, just to kind of summarize what I said, those are the take-home messages from the Board of Health. COVID-19 appears to have less effect on children than on adults, and that's a fact. So the children are probably relatively safe. Adults, teachers should be, viewed with a little bit of more caution. I think they're right to be a little bit more scared than maybe some parents are. As children in schools are unlikely to be main drivers of COVID-19 transmission when community transmission is low. And that's really the most important take-home factor, that the community transmission should be as low as possible. And that's what we all can contribute to a successful school opening without any incidents. We will see positive cases because community transmission is mirrored in school rates, school COVID rates among students and among staff. But then we need to make sure that appropriate mitigation measures are applied. I think that it's fair to say that more caution is necessary regarding high schools, secondary schools, and older students compared to young primary and elementary school students in terms of their likelihood of developing severe disease and contracting and transmitting the virus. And then adult personnel is really at the highest risk of acquiring and transmitting the infection. And that's just because adults are more likely to get sicker. Adults have usually more contributing factors, predisposing factors, and also, as we know now, probably have more receptors for the virus in their nasal mucosa, and that's why they might be more susceptible to actually acquiring the infection. So control measures are very important to protect the staff. And then we need to make sure that isolation and quarantine measures are built into the safety plan for the school. community transmission has to be factored into the decision for making for or against reopening. And I think that's my most important take home point. Adherence to public health measures in the community is absolutely critical to protect the schools from amplifying transmission. They will only amplify it if we have high numbers. If we have low numbers, there's nothing that we should be scared about. So we really need to make sure we get our numbers down, first of all, again, and keep them down. So the community effort will be extremely critical here. And then last but not least, I think what we need to make sure is that our health department is not overwhelmed. And they're already at a breaking point right now with a lot of cases that they have to contact, trace, and call and make sure and follow. So the viability of our health department is absolutely critical for an effective outbreak prevention and control. So really, this is my most important take-home point, really, is the last one, that we need to make sure we protect our health department and support our health department. And the main support that we can give them is to keep community numbers low as possible. And that's really all that I have today. Thank you.
Thanks.
Thank you, Astrid. I know you guys have another meeting to go to, Bill, but is there going to be any time for either a member of the school committee or myself just to have a quick follow-up question or point?
Absolutely. We can have a discussion. We can postpone our meeting a little bit.
Yeah. So I would say, and Susan, first of all, let Susan McGuire, maybe you have some comments you want to add from the board's perspective.
Here I am. Okay. That's I don't know how anyone can follow up Astrid's presentation. Thank you, Astrid. If anything, I think it's more than convincing. I think that we revisit establishing timelines for reopening. I guess quickly, my recommendation that is to watch the data and revisit in mid-December. I think we'll have 3 more weeks of trend data. My other recommendation is, how can we increase our mitigation on a community level? I know we've had this discussion before, but I think we need to continue to do that. And my last point, I think we probably know New York's benchmark, or their threshold for reopening schools, is a 3% positivity rate. So I can't thank you enough, Astrid. Great job. And Lisa, thank you for inviting us.
Thank you for coming.
Yeah, let me just make one other comment, because we are going to try to get to our other meeting not too late. But I think it's a very difficult choice you have before you, because obviously there's a lot of, everybody wants the students back in school. The question is, what's the correct timing? And I think, just from my own personal perspective, given the holidays, given the fact that, given the data that we just showed there at 4.85, it's very possible that we'll be in the red again in the next week or two. And so the question you might have is one of timing, and whether or not starting in December between the 2 holidays is a good choice.
My recommendation would be to wait until January, just because my opinion is always, the devil you know is better than the devil you don't know. And I think we don't know exactly where we're headed right now. We're kind of flying blind. You know, we know the numbers are going up, but we don't know where our community is going to be. And I think the next couple of weeks will be very important to see what's happening with Thanksgiving and where we're going to end up. I think overall it's possible to open schools in a safe way. I personally am not a complete, antagonist to opening schools. My own child is in a school right now. But I think that it has to be done with the utmost care, and the community has to be completely behind it.
So,
Brian?
Lloyd.
Yeah, I just want to thank the Board of Health for joining with us, and I want to thank Astrid for her presentation, and Bill and Susan McGuire, who unfortunately is going to be leaving the Board of Health, and sent me a letter of resignation. I wanted to take this opportunity to thank her for her service publicly for the many years that she's put into the Board of Health. You're going to be hard shoes to fill, Susan.
Oh, well,
And-
thank you very much, President Boncory. Thank you.
Thank you, Susan, for all your hard work.
Thank you.
Well, thank you all. Thank you all. We're going to try. We're already 10 minutes late to our meeting, so we'll leave the discussion to you folks. And as Lisa stated, feel free to reach out to any one of us on any of these questions.
Tim and Schmidt, can we just have one question from Mr. Capabianco, please?
Sure.
Thank you, Astrid. Thank you, Susan. Thank you, Mr. Schmidt, for that presentation. Look, my personal opinion is it's unsafe to go back. However, we're in the yellow right now, and our job isn't to give personal opinions. It's to follow the guidelines to the best of our ability. And I know other communities have given, boards of health have given official recommendations. I know that happened a few weeks ago in Milton. So we appreciate your opinions, but if we were going to follow the guidelines, the Board of Health needs to offer an official position, not a personal position.
I think our official position is pretty clear. We all agree that you guys should wait until after the holidays. That is our official stance, and we can vote on that on our next meeting if that's something that we should do.
Well, our meeting which is following at 6:30, which is now about 10 minutes late, Mr. Capabianco, I will bring this before the board, and we may very well take a vote at the meeting. And if we do, we'll share that with you.
Well, then how could we vote on it before you guys if we want to follow the DESI guidelines, if we're taking collaboration? That doesn't make any sense.
I'll let you folks decide that question. All right. Thank you very much.
Thank you very much. Much appreciated. Thank you.
Bye-bye.
Yeah. Wish you well. Good luck.
Thank you. Doctor, thank you for your presentation.
Thank you.